The way our country is not caused by doctors. Nigeria cannot be in a mess and you expect the healthcare sector to be an idiot. It cannot work. One, the electricity that needs to be supplied will not be supplied by doctors. Water supply that need to be supplied will not be supplied by doctors. The medical equipment that are needed and to be provided on time will not be supplied by doctors. CS is not an abnormal disease. I need to emphasize this. Where I work, there are seasons and times whereby the organization work will provide free Cesarean Section services for women. We now discover that women that have been hugging with us claiming Hebrew women, they don't want to do sex. By the time they discover they are not going to pay, they willingly give consent. There's no specific number of Cesarean section a woman can have. At least I've done 4, 5, 4. Many women have had 4 CS.
Wow.
Many, some have had 5, and I've operated 6. So I was looking for 7th one. It's a challenge to the house.
The job is kind of dangerous.
That's the truth.
Wow.
Because you see, when you stand in the place of God and you are not God, it's a very delicate position.
It's not curable.
Cerebral palsy is not curable unless God performs a miracle. One of my FA patients that traveled to the States, to the US to deliver, I have counseled her before that will be cirrhosis. She got there and they were telling her, no, you can still try, you can still deliver. They removed the surgery and later, they just give her double suffering. You see, labor and in the long run develop preeclampsia, they rush at the theater. I told her, you see, it's not, it's the country that's messing us up. We know what we're doing.
Welcome to the Happy Family Podcast, Season 3, Health is Wealth. I'm talking about Lady, and I'm fondly called Uncle Tokes. The life cycle of a pregnancy requires utmost care and a requisite knowledge for a safe delivery. And that brings us to the topic for today, Cesarean Section. But before we get to introduce our special guest and also connect with my family member, would like you to subscribe to our YouTube channel on Dr. Shina Aladejubelo TV so you can get to watch previous episodes and also these current episodes. Yes, very shortly we'll get to meet our special guest. We'd like you to know that pregnancy is a project that requires utmost care. You really need to pay attention to it, so you can get the end results and to make sure it comes out the way it's meant to come out. Yes, we have my family member in the house. Yeah, you're so good to have me here. I'll be on the program again and again.
Thank you. I like that. There's this phrase you just made that pregnancy is a project. Yes, it is. It is a very big project. Going through a journey of 9 months, some people 10 months. It's a really big project, and it's a good one too. So I'm so excited to be here again today. I'm so super excited, especially with the topic, because I'm a woman.
No, I think you're biased.
No, I'm not biased. I
was pregnant with my wife.
yeah. But you would not know how it feels, Gogo, because the fructose are excusing. Maybe it wasn't inside your stomach.
When I have to wake up in the middle of the night and jump to pick up one thing or do something.
You were part of the project. Yeah, you planted it. Yeah, or you did not carry the baby inside your stomach. It's my stomach. You did not carry the baby inside your stomach. So my name is Olapisi. Thank you for joining in again.
Thank you so much. It's so good to have you here one more time.
Thank you.
Yes, and our special guest is Dr. Noah Olaumo. He's the medical director and also consultant gynecologist of Medicus Specialist Hospital, and he's right here with us. Of course, in previous season, we had him on the show, and trust me, you want to watch that one. And this is going to be explosive. It's so good to have you here, sir.
For coming on board, and I'm also very delighted to be one of the project managers. You had said that pregnancy is a project.
Yeah.
We are being opportune by God to be the put them in.
yes.
The gynecology.
We all agree that it's a project.
Yes.
The big
So which is very important. We know how we manage the project. So we are here today to see how the project should be managed to avoid complications, so that we won't be having building collapse. And the way it is everywhere.
I have a lot of questions.
Do you know when he was doing now, he has expanded it further in regards to saying it's a project. And so to look at project, if you look at project management, they're talking about time, scope, and cost.
And using experts at the right time.
Now I'm seeing project management in a different level right now. Talk about okay, let's jump to a core question that will give birth to other questions. Is CS a good thing or a bad thing?
Well, you see,
Cesarean Section, yes.
yeah. Like I used to say, LG, you know, they are popular electronic band. Life is out.
Life is
So anything that makes life to be good, for one to enjoy the benefits and the goodness of God in the land of people, can never be bad. CS has saved countless lives of women and babies. So CS is a very, very good thing. Unfortunately, our people has bastardized and maligned Cesarean Section and all the project managers like us that are involved in carrying out this wonderful life-saving medical intervention. CS is very good when done properly for the right reason, in the right hospital, and for the right patient. It's very good.
sir. So because it's good now, does that mean it's why we have high rate of CS now than before?
Now, you see, that's a subjective assessment. When we say there's high rate, what are we comparing it against? That means we assume that it was low or lower previously. Now, if we look at it, for instance, what are we comparing it against? There are more availability of more hospitals and personnel than it was, let's say, in 1920 something in Nigeria or in the colonial period. Like there was a time in my own place where I grew up, the beautiful city of Okeo in Okeo, nothing. There was a time there was no hospital there. That when there were any issue, they have to carry family members, people to Shaki that they're about 3 to 4 hours drive from our town. And you know, some women who are needed Cesarean section, they will not have access to it. Some could have even given up in the process of transporting them to that city. But now that we have relatively more hospitals, we are not yet there in Nigeria, relatively more doctors and specialists than before, there will definitely be a relative increase. And also, this increase is also because there's more awareness. There's more, apart from more availability, there's more awareness, and there is better education compared to that time. So there will be relatively an increase. And we should also come to that even patients themselves are beginning to request for Cesarean section. There are patients in the hospital that will know this does not need a Cesarean section, but they will insist, doctor, I want a Cesarean section.
What I want.
And since they are adults with their senses intact, we have to accede to that request.
Okay, sir. So I also heard that most hospitals now advise people to go for Cesarean section. Is it because so that they can have money in their pocket more, or
That's about
Yes. Well, this question is a very pertinent question.
because
and
people
this-
can actually give birth in the Hebrew way, the Hebrew woman?
like I used to say,
how their babies are.
we are not Hebrews, we are Nigerian women, but we are children of Abraham. We are not Hebrews, and we need to. If we look at the context of the Hebrew woman in the Bible, then nobody would really want to be in that situation. They were slaves, and technically speaking, the midwife did not really portray the actual picture of what was happening. So the Hebrew woman context is a misunderstood concept that led many of our Christian ladies and sisters to die avoidably. Now, when with the issue of financial perspective to CS, it is not true. Though truly in every profession we have the bad eggs. It is true in every profession we have people who are only interested in money they can make. Yet there may be some few bad eggs among doctors who will cancel patients for the sake of the money. But the majority don't cancel patients to do so because of the financial they know. We should also come to terms to that the society is becoming more medical legally conscious. They are becoming more aggressive toward healthcare providers. And I used to tell people that the way our country is not caused by doctors. Nigeria cannot be in a mess and you expect the healthcare sector to be an idiot. It cannot work. One, the electricity that needs to be supplied will not be supplied by doctors. Water supply that need to be supplied will not be supplied by doctors.
Yes.
The medical equipment that are needed and to be provided on time will not be supplied by doctors. For instance, I work in some government hospital that we had to cancel a pre-planned operation because there was no water in the theater.
Wow.
I, as a doctor, will not be the one to supply water to the hospital. But the society make the doctor a scapegoat of that. The patient was so angry with my superior that I've taken leave, and my superior was ready to do this. All of us were ready, but there was no water supply in the hospital. That was beyond us as doctors. That was a government responsibility, the management responsibility to provide water in that hospital. Now, regarding the financial perspective, it is not true, though there may be a few bad eggs. Generally, when people have to pay for service, they become angry. For instance, where I work,
Especially such kind of
they become
service.
angry, they get pissed off. Where I work, there are seasons and times whereby the organization work will provide free Cesarean Section services for women. We now discover that women that have been hugging with us claiming Hebrew women, they don't want to do sex. By the time they discover they are not going to pay, they willingly give consent. So a lot of people make this false accusation because they are angry, they feel the doctor and the hospital are fleecing them of their adult. It's not always true. What I advise people that when they feel that the doctor is canceling them for pecuniary gain for money, if it is not a life-threatening situation, seek a second opinion. Like there was one of my friends, we served together as youth corpers. When she was pregnant, was far away where I was, but we were still in touch. She contacted, they used to call me Papa, when you were pastor for corpers or a pastor. That is what they're telling me, and she's supplying all the scan and everything. Where I told her, well, I'm not convinced that you needed the Cesarean section at this material time. But because I was not physically present with you, I want to have also learned that you might not be providing with all the necessary details. What I would advise you to do, go to another hospital. Go to another facility where they have gynecologists. Let them give you a second opinion. And that's what she did. She delivered and said,
Wow.
so there are instances when when you feel that they are pressurizing you because of financial gain. But it is not, if it is not an emergency. She was not yet in labor. There was not any immediate life-threatening situation to her and her people. So she went seek a second opinion. Most times people just conclude that the doctor wants to collect their money and they are better than losing their life and losing their baby. It is not true. CS is a life-saving procedure. And before I draw the curtain on this topic, this is what I used to throw to my people. In the days of our Lord Jesus Christ, there were no aeroplanes, there were no cars. Our Lord Jesus we used to travel by donkeys, horses, by trekking, and by using old-fashioned canoes and ships on the sea. But now in our time, we as Christians, we don't have any issue driving the latest car. Nobody argues that as an Hebrew woman were not.
I'm already thinking of where you're going.
Yeah, we don't argue about traveling by plane. We don't argue about going on the serious trip with all this latest shit. But we argue with the Cesarean section when there's why? It is the same technological and medical innovation that brought CS to pass. Now, let me go a little backward to the historical perspective of Cesarean section. In those days, Cesarean section was only done as a last step. Because once it is done, it is certain the woman will die. Like in the Roman Empire of those days, where it is postulated and thought that Cesarean section was created from, it was a measure to save the life of the baby, not the mother. At any time in those days, one labor I forget to the extent that this woman cannot put through. They will cut the open the tummy of everyone to break out the baby. And it's also written that they were also trying to use that as a means to increase the population of Roman Empire in those days. Because I think if the woman would die, let's save the baby. So in those days, technology, medical science, blood transfusion science were not available to us certain that the woman would die. But over time, technological and medical innovation, blood transfusion service became available, antibiotics became available, anesthesia became, and a lot of other things. Cesarean section is very, very safe now. But if you could now willingly accept all those good other benefits that make us become like big boys and big women, the latest car, this aeroplane, now we use a selective, people selectively now choose what satisfy their mind. Cesarean section is not evil.
Okay.
It's not of a culinary grade.
All right. Yes. Okay. You've talked about technological advancements that we are very safe. We are really accepting without questions. But I think I have a bias. A bias is I don't want my wife to go through a surgical procedure that disfigures her physically. And in this part of the world, let me not speak for the Western world. What I see, my opinion, is that women who go through cesarean section end up having somewhat a disfigured body. I think maybe because my dad was a doctor before he died and a gynecologist, I think maybe the what they call surgical procedure in this, I'm talking about this teaching, is probably not, it's done haphazardly. Because we've seen people who get caught on their bodies and we see the stitch. It's not a straight line, not properly done. I don't know. And it looks awkward. You know that it was shabbily done. For example, I have a scar on my palm, and you could see that. I remember when the doctor was doing it. It was just like he was stabbing something. It was not cheerfully done. So I don't know. That's my bias. I think it disfigures the woman. So what do you have to say, Nijo?
Well, practically speaking, and for business me, that is not true. Because I have family members that have done cesarean section. Even my wife has done cesarean section 3 times.
Wow.
I have to bring that forward so that my wife is not disfigured. She's looking better by the day. She's not disfigured. And I've done several cesareans. I've been present for 90 years. Even before I became a specialist, I became cesarean section. They don't get disfigured. And I'm visiting it at my vicinity here. There are many of my patients have done cesarean. We won't know. So cesarean section does not disfigure women postpartum. I mean, after delivery. That's why there's many factors come into play with that. There are a lot of women who have not even delivered through cesarean section who are also looking disfigured. There are many around. So there are women who, after 1 or 2 babies, they are looking like figure 8 before they look so big and their husbands are brother. How would they lose weight? It is true that after a cesarean section, the rate at which the womb that carries the baby will return to the pregnancy stage is slower. Take note of that word. It's not abnormal, slower. Or ultimately, it will get back to normal.
Really?
So, yes. But a lot of things that happen to how woman look that being disfigured is not from the cesarean section. It's from the process of pregnancy, breastfeeding, lactation itself. No, women add weight. They need extra layer of fat and calorie to cope with pregnancy and breastfeeding. And it is easier to gain weight than to lose. So a lot of women after that have been done, they begin to struggle, it become a third world to lose weight. Regarding this car, I've also done a lot of fantastic CS that recently, one of my patients happened to relocate to the US. And after I did the first CS for her, she delivered her second time, she got to the US. So, and you see, a lot of times, some of these countries and people there, if I've listened to some interviews, some of them think Africa is a country. Some of those whites, the fact that white does not mean they are better educated than us. If you have watched some interview where America have interviewed, some of them assume that Africa, that has about 52 of its countries, is a country. So the lady just have to come in. I think the doctor maybe was Caucasian or Indian, I don't know, but in Nigeria, they do CS, you look at the scar, very neat, almost imperceptible. But you mean this cesarean section was done in Nigeria, and you want to try to do it, it was shocked. And I felt embarrassed. In this age that Nigeria has about more than 200 million people, and we are the leading light of Africa, somebody in the US will think that we are still living the Stone Age. There are wonderful cesarean sections that you even be looking for this car. It doesn't disfigure. And that's why if you could cast back your mind, at the beginning of the discourse, I mentioned that if it is done properly for the right reason and the right hospital, by the right competent doctor, and at the right time, it doesn't disfigure. But we should also know that complications can arise, even in those countries you mentioned. Patients that have done surgery over there, they came back to us in Nigeria to rectify it. And people who leave those countries to come and do surgery with us. And we know in those countries, the US, UK, Nigerian doctors are among the best. It's a globally no pass. They don't disorder. This year alone, I've had about 2 people come to me from UK to do surgery in Nigeria. And they have gone back.
I think one of the reasons, my thoughts though, is that is cost effective.
It's cost effective, one, and also it's very access is difficult there.
Okay, true.
And because they know we are competent. Most of the people in the media are also Nigerian trained doctors.
True.
We are calling come through.
Okay, so sir, thank you so much. So I want to ask, like, how many hours can a woman be in labor and the doctor sees that this child is not forthcoming before the doctor can say, okay, let's go for a cesarean section for her?
Now, we have different types of cesarean section for me to be able to address that question properly. Okay. We have the one that is pre-planned. We call it elective. Meaning that Both the doctor and the patient and every health care worker already know this woman will deliver by cesarean section. So a time that is convenient for both the medical team and the patient will be chosen. And also convenient and appropriate for the baby. We have preterm and term baby. So that's an elective cesarean section. The woman already knows, the medical team know for one reason or the other, this woman cannot deliver herself, we have to do a cesarean section. The time will be fixed. The woman will come to the hospital, not in labor, admitted, and cesarean section will be done. But there are instances that the woman there have never been any reason known prior to that time why she should opt for cesarean section or why she should have been cancelled for cesarean section. She come in labor, and in the process of the labor, we now discover that for reasons whether because of the mother or the baby, this will not be allowed to progress if we want good mother and good baby. The ultimate outcome of pregnancy to have a live mother and a live baby, and both of them in optimal condition. So what we determine that is not only the time, it's also the state of the mother and the baby. For normal labor, averagely we talk a normal labor should not last more than 8 to 12 hours. But a lot of people who are not those for the first child, that's why I'll give you whether first or second, give that range 8 to 12 hours. 8 to 12 hours. A first timer will spend longer time than a pro. When I say somebody who has delivered second, third is already a professional in that field, a coach. Now, but it's not only time that will make us decide that it is enough, this labor is no longer safe for either the mother or the baby. The labor might not be safe for the mothers or for the baby or for both of them. In term of duration, time interval, a labor is regarded as becoming prolonged if it's lasting more than 12 hours. Generally speaking, there are still a woman can still be allowed to labor more than 12 hours and not be prolonged. There are other criteria we look at. Like she have adequate contraction and all those things. But since it's not a core medical lecture, don't let me go into all those details. But averagely and generally speaking, we give 12 hours. But a patient also count the onset of their labor as laymen. The fact that you're having pain like on that does not mean labor has started. Because we have what we call latent phase and active phase of labor. The real timing of labor starts from when the woman gets to active phase. A woman will say, my tummy is paining me, I will check the hose may still be closed or to see real labor has not started. That timing will not be calculated within the range of 8 to 12 hours I mentioned. Because you see some women will say, I labor for 3 days. And if they are going to a standard hospital, they did not labor for 3 days. Most of those 3 days they were counting were maybe they're having off and on pain and real labor has not started. To us as professionals, we say this is not labor. There are times we categorize as forced labor. Force. Yes. Fake labor in quote. The woman is having pain is not producing any labor changes. After some hours, we will notice happen, we give them pain relief, and if some will allow them to go home. But some of them they are sharing testimony. I was in labor for 5 days. What actually asked some of them, which hospital did you use for your antenatal? If it's a standard hospital that have a gynecology well-trained doctor, will know that they were not in actually. So the time interval, it will vary depending on, you see a first time about 8 to 12 hours. But the reason why we will cancel a woman to undergo cesarean section. So a woman may come in labor and we did that to say, well, see her straight. If she start bleeding, for instance, and it's born. Okay. Or we check the heartbeat, in labor, you have been in labor, we always check how the heartbeat of babies. There's some people who just check the heartbeat, they will be giving a warning sign. Mr. Man, the fetus, that's the way they communicate to others. I'm not comfortable here. I need to be out. I need to be out. It's not about time. It's even within 30 minutes. Some way, as they are coming to labor, we're already rushing them to theater. For instance, if the cord is what supplies blood to the baby, oxygen and everything from the placenta. If the cord happen to protrude out, what we call cord prolapse, anywhere in the world is a dire emergency. Because nothing is done and something compressing that cord, the baby may have only 30 minutes. Wow. We have to pick race straight to the theater and break out the baby. So what determines the time interval? Because I see some patients who call that hospital, they are wicked. They didn't even give me time. There are times that a competent doctor will not give you time. If we discover this is a serious emergency, or a woman is bleeding, the placenta is following, the placenta separating before the time. Normally, placenta should not separate until baby is born. But at the time the placenta will separate before that, that's a dire emergency. The woman will start bleeding. And a lot of time, the baby will even be there before you can have. But there are instances we can see this baby is still alive. So that's not the time we're talking about Dr. Lamon says the normal labor is to take over. That one be Kuma move. Visa instant. So there are many criteria, many principles.
First one as elective. So what would you
The other one is emergency. All these one have become emergency. So most time women in labor that will now cancel to go for CS, they will fall under the category of emergency cesarean section. So that answers the question.
Wow. So much to be shared. Okay, let's talk about what a pregnant family. Permit me, I'm using family because I always say the other one to be pregnant. And what should they plan for so as to avoid CS?
Okay, thank you so much for
Because so many people don't want to hear that word CS. And so what can they do to ensure they do not, end up having their babies via CS?
Well, it is important for us to realize that no good antenatal care is complete without them educating the pregnant about the possibility of cesarean section. Because, for instance, let's talk about emergency. Emergency means something nobody is envisaging, and it can happen to any pregnant woman. And we also need to come to terms with the fact that all pregnant women cannot have normal delivery. Is a truth, is a fact that people don't want to hear, or is the truth? If you want safe mother, healthy mother and baby, all pregnant women cannot have what we call normal delivery. CS is not an abnormal delivery. I need to emphasize this. But what we call normal delivery, that is the woman delivery vaginally herself, not all women can achieve that. Even there are instances that some women have delivered normally 4 babies. The 5th baby will be cesarean section. By the time we start talking about reasons why says I don't understand that. So it is important for us to stand this fact that any pregnant family, and truly men are pregnant, when your wife is pregnant, psychologically you're pregnant. You are thinking about a lot of things. Those who are medical personnel. Because you see, we know the do's and the don'ts, the pros and the cons. Even when something seemingly harmless happens in your mind, especially as a gynecologist. My last baby, something happened and I've gone, my mind has gone far. My wife does not know what was going in my mind. She was there looking, what is wrong with this young man? I said, I just saw something. But different scenario was already going through my mind that I could not even tell her. Just follow me, we're going to do scan. After I've scanned her and I saw everything is normal. But I was under tension more than that. Because it was my feet. A lot of things were going through that I could not even tell her.
But if you went through that, what do you want us to do?
No, at times, knowledge can terrify. Okay, you understand? What we tell lay people along that we just relax. And truly, my wife could not read the anxiety in me, but a lot was going through my mind. Wow. A lot of things were going through my mind then.
So she's going to be hearing for the first time on this program.
No, after that. So, after the danger, the scare was gone. I told that is what I was going through my mind that she did not know. Because being my feet, I've thought I've gone far. This and that. So, but there are instances that cesarean section will actually be prevented.
Sure.
And I always tell my client that no, it is not well for you to be running away from bicycle and go and collide with a trailer. That's what some of our pregnant women do. For instance, now when I've all started working where I'm working, a lot of people nickname me the CS doctor. And I thank God, I was like, maybe I will drag here by God. If I know, I never imagined I would work here. There are times we cancel pregnant women. Your pregnancy has gotten to this stage. Let's say this, doctor is not CS. They want to make labor to start. But some people will tell them, you see, Dr. Lambo is going to do CS, so you don't listen to it. Don't follow him. They will run away. By the time they are coming, the only option left will be to be CS.
Yes.
For an example, a pregnancy should never be allowed to exceed 42 weeks. Okay. 42 weeks. No pregnant woman who's having a good and quality antenatal care should carry pregnancy beyond 42 weeks. So when the pregnancy is delayed, some baby likes to create room and parlor, do places inside their body. Some baby, if you leave them alone, they can even stay up to 43 weeks. They will do the last. But as the pregnancy advances, the placenta reserve, their food reserve is drying up. Placenta is the food reserve. And being a living thing, the living organism, it be aging. And it can pack up what we call placenta insufficiency. So most time everything is normal. By the time the woman is approaching about 41 weeks, we cancel them. Let him kiss you, let the baby come out. There are some women even before that time with cancer, but some women will say no. Some people with cancer wrong, they don't listen to that doctor. It's a ploy to go and do CS for you. By the time they run away and come back, some of them, the baby will have become bigger. Not safe for them to navigate. Some the water will have completely dry out. Because placenta is the major source. Through the way the placenta work properly, it's how water will be supplied. Amniotic free.
My wife, I learned that I do with my wife.
We see water so that they will not, but amniotic fluid, also call it liquor. The liquor actually is the urine for the baby. So the way the liquor the baby urinate to replenish the liquor, swallow it back. The liquor is very sterile. It's holy. They use that one. That is only water. But the baby will not be able to produce adequate liquor if the placenta is not working properly. And as the pregnancy advances, gradually the placenta will become insufficient. So some women will run away and come back when the placenta has actually become insufficient. So the only option there would be Cesarean section. So there are one way to prevent Cesarean section: listen to your competent doctor. You may not be a gynecologist, because there are some places that are not gynecologist, but there are equally competent doctors.
What is that word?
Competent doctors. Listen to their advice, and then go for proper antenatal clinic. Good antenatal care can also prevent Cesarean section. For instance, now a woman that have good antenatal care should not have what we call eclampsia. Eclampsia is when the BP of the pregnant woman goes up. There's protein in the urine and she starts convulsing. The woman can be convulsing in pregnancy and she doesn't have epilepsy. If you have good antenatal care, you can have what we call pre-eclampsia. From the word pre, before eclampsia. At the stage of pre-eclampsia, it can be picked up and managed. The woman can be induced and she will deliver. But some people will go to some TBA, transient birth attendant, or some places where their BP is up. They will tell us because you are overthinking. They will tell us because you are not sleeping, and the BP go keep rise. By the time they refer them to us, they are already confused and they are not in labor. At that point in time, we have to do a Cesarean section most of the time to bring out the baby. And some other patients, maybe they are not using their proper medication to prevent some other complications. So it can also be prevented in some instances by good antenatal care, using competent hospital and doctors for antenatal care. But the summary is that every pregnant woman should have an open mind. Both means of delivery are possible. Whether it's Cesarean section, which is also not abnormal delivery, or normal delivery.
Thank you, sir. So, like, I want how many times can a woman go through her cesarean section?
Okay, that's a very popular question too. And that this popular belief that a woman cannot do Cesarean section more than 3 times. It is a lie.
We grew up on that for so long.
Yeah, it is a lie. There's no specific number of Cesarean section a woman can have. There's no specific number of Cesarean section a woman can have. Patient based on their history and also based on the economic consideration for those who want to be responsible. Now, traditionally speaking, there is this popular belief that after 3 Cesarean section, the woman should not have another. It is not true. And then the highest I've done so far is the number 6 Cesarean section for a woman. And both the mother and the baby, they did well. So I'm looking for a woman who break that record for me. If you know anyone, I'm at home already. But the truth is that some patients would after one Cesarean section will tell them not to try pregnancy. So it's patient specific. But generally speaking, if every day is normal, it is true that most doctors, during gynecologists, will counsel a woman who happen to have had 3 Cesarean section to put a stop to it. Not because she can't have another one, because after 3, what do they look for again? If all the 3 are alike, and if you are okay, no go right, it's okay. But there's a time some of our patients from particular part of the country, they will never be satisfied with 3. Even when the 3 are alike, they still go for 4th, for 5th. So there is no specific number of Cesarean section a woman could have. But before you call to Dr. Lawa and say I can have infinity number of CS, please, you need to see your gynecologist who will assess your medical history. It is a personalized advice. This advice is not for general public that you can have see. The first reason why it is personalized is that do you have the money to pay school fees for 4 children in this present economy, which is very important. For talking about medical reasons, you can have more than 3 Cesarean sections. But before embarking on that journey, see your doctor who knows your medical history, who will counsel you on what to do, whether it is safe or not. But you can have more than 3 Cesarean sections if it is safe for your health and for your well-being. At least I've done 4, 5, 4. Many women have had 4 CS.
Wow.
Many years, some have had 5, and I've operated 6. So I was looking for seventh one. It's a challenge to the house.
Thank you so much, sir. Thank you. Thank you.
Uncle Jokes, I want you to
Okay.
make the
Suzanne, boy, no. I don't know you. Never met before.
So I want to ask, this Caesarean section that we are talking about, what are the causes? What's the cause of Caesarean section?
Okay, the reasons for this.
The reasons.
Yes. The reason is why. The reasons are many, rather.
Okay.
And for us to understand, I'm going to break it down into reasons for cesarean section arising from the baby, reasons from cesarean section arising from the mother, reasons for cesarean section arising from the placenta, and some arising from both of them, so that people can understand.